Hello everyone, my name is Nicolette and my presentation is on the condition gout. To define gout, I chose this quote by Dalbeth for those who've never heard of it. Dalbeth defines gout as an excruciatingly painful inflammatory arthritis triggered by the crystallization of monosodium urate in soft tissues and joints. To further define gout, let's talk about the symptoms of this condition. The most common symptoms among all four clinical phases of gout are tenderness, redness, warmth, swelling, and fever. These symptoms are usually present in the feet or the knee area. Depending on the phase, the pain and the area of infection changes. The further a patient is, the more painful the symptoms are and the more areas are infected. For example, somebody in phase 1 would probably only feel slight warmth and a little swelling, while someone in phase 4 would feel needle-like pain and even broken bones. All of this information is from Fallon. Now that we understand the symptoms, we can talk about the four clinical phases of gout. The first phase of gout is asymptomatic gout. This phase holds the least amount of pain and can usually be treated without medication. It's also the most common among the other four. The second phase of gout is acute gout. This phase is a bit more serious and is often treated with anti-inflammatory drugs for the swelling. The third phase of gout is intercritical gout. This form is special because it has months of dormancy, meaning you can have an attack on your knee 1 month and then about 6 or 7 months later it can either change parts or you can have the same area infected. This phase is also tricky to deal with because of its dormancy. So you will need to have a lot of doctor follow-ups, and the medications will change quite often. The last phase of gout is phase 4, which is chronic tophitis. It is caused by ignoring the 3 earliest stages and is the most serious. This phase can damage bones and even cause kidney stones. This phase is also the most expensive to treat. To explain these phases more, I decided to create a diagram. So stage 1 is going to be the first picture. It's going to represent asymptomatic gout. There's going to be no buildup. Your urate levels are going to be pretty normal. There's just going to be slight swelling. This can be cured through some diet and exercise, no medication, and sometimes no doctor visits needed. Phase 2 is where it gets a bit more serious. There will start to be block up in between your bones. This is due to the high urate. Nothing will break and there's nothing too serious about it, but you will need inflammatory drugs. Stage 3 is where the buildup continues to worsen, and this could be because you're not taking enough of the medication or you're not changing your diet correctly. If stage 3 continues on the way it is, then stage 4 will happen where the bone will completely break, and not only will you need more drugs, but you will also need surgical procedures most likely. Now that we can define gout, the clinical phases, and the symptoms, we can talk about the factors. There are 2 factors to getting gout. There are genetic factors and there are modifiable factors. Genetic factors are what you are born with and they are uncontrollable. Examples of genetic factors are age, race, genetic makeup, and gender. Age-wise, the older population is affected by this condition more. Race, African Americans have more cases than any other race or ethnicity. Genetic makeup, which is dependent upon the patient's family. For example, if their grandfather and so on had the condition, they are more likely to have it as well. And gender, males are more affected by this condition than women. These are the modifiable risk factors. They are diet and medication. There are certain foods that can give a patient a higher urate level and lead to gout. Foods such as shellfish, organ meat, alcohol, and coffee are all the biggest causes. Medications that will give a high urate level or lead to hyperuricemia and or raise blood pressure will also give a patient a higher level of gout. Even though there are millions of people affected by this condition, why should it be a public health issue? Not only is there an increase of these cases, but there are also an increase of financial damage. So as an increase of cases, Dalbeth says, the prevalence of gout in the USA more than doubled between the 1960s and the 1990s. This is also continuing to double over the years. McFarland says gout is associated with high economic burdens resulting in 5 or more absent days from work and more than $30,000 in additional annual costs compared to patients without gout. This means that this condition is not cheap to deal with. Not only do you need the medications required, you also will at times need surgery. And if this isn't resolved, hospitals and healthcare will receive more of these financial burdens. As I said before, millions of people are affected by gout, but to break it down even more, according to DalBEF, 6.1 million men are affected by gout and 2.2 women are affected by gout. And the annual treatment cost is $3,000, but without insurance and depending on where you live, it can easily be higher. As a public health issue, there are primary, secondary, and tertiary prevention strategies. The primary strategies are diet, medication, and knowledge. If someone is aware of the right foods to eat and the correct diet to maintain, gout can be prevented for those at risk. Avoiding foods and medication that cause high urate levels are also primary strategies. Secondary strategies are for those with symptoms of gout and how they can improve their status. For the early phases of gout, there are anti-inflammatory drugs or NSAID drugs. The tertiary strategies is surgery. Most cases of gout don't need surgical procedures, but sometimes when a patient's tophi level is too high, it needs to be removed, or if a bone is broken, it will need to be reconstructed. In conclusion, there are prevention strategies and treatment options for each clinical phase. The risk factors are race, gender, genetics, medications, and diet, and this issue is important because of the possible economic impacts and the amount of people it affects. These are all my works cited. Thank you.